entering a new phase of AI in healthcare, one that goes beyond analysis to action. Agentic AI systems can understand context, make decisions, and execute tasks across care workflows. At a time when healthcare is under pressure, this shift is enabling more efficient, proactive, and connected care delivery. Welcome to Visionary Voices, the podcast series by To The New, where we speak with leaders shaping the future of business and technology. I'm your host, Maulika Gopal, and today we're exploring the intersection of AI and healthcare. Joining me today is Anurag Agrawal, Business Head Americas at To The New. Anurag brings deep experience working with global healthcare and enterprise organizations, helping them adopt AI, cloud, and data-driven platforms to drive real-world outcomes. In this conversation, we'll explore how AI agents are transforming healthcare workflows and what it takes to build trusted, scalable AI systems. Anurag, welcome to Visionary Voices.
Thank you. Happy to be here.
Okay, so we'll start simple. These days, everyone is talking about AI agents. How would you differentiate between the traditional healthcare AI and AI agents?
Oh, good question. So, if I explain in a very simple way that normal AI in health tech is at the task level and agentic AI at the workflow level. Let me explain a little bit in detail. So, AI has been being used in health tech in a much more longer time as of now. If I take a very natural example, that for example, there is an X-ray or there is an MRI film, a normal AI will be having a review of that and will be talking about what is wrong in that or maybe wrong in that one. But that's not what end objective is of this thing, right? Any individual, if it is for me, me as a patient, I would like to have what next around that, what I am supposed to do. Let me add the agentic AI on top of this. So what in this scenario agentic AI will be doing, for example, the next action could be, it should inform my doctor, it should inform my hospital, maybe depending on the situation, it may inform my insurance provider, it may take my appointment. So that's been the workflow of getting involved into the entire situation, not only at the task, but owning the workflow. And that's the difference between normal AI and agentic AI in health tech.
Okay, that's a helpful distinction. So continuing that, we've been using AI and experimenting with it for years in diagnostics, in predictive analytics, right? So how would you say that, is it just another AI wave that's going on, or it is something different?
It is definitely different thing, right? AI as of now is being used as a tool. Tool means that we are asking something, some specific thing, and it is giving us some answer or maybe some suggestions around that. But agentic AI is completing the entire workflow, as I mentioned earlier, right? So what does that mean? That it's a ecosystem, right? Whenever there is something is happening to an individual, that person is willing to go for some tests, some appointment, we all into that system, and we know what all things keep happening. So if we complete entire thing, then it's a very big chunk of work. And let me share some data around that okay, a health practitioner spends an hour with a patient, and on top of that it spends 2 hours with other things, which are admin things, which are basically other things which are not actually related to the health or the actual discussion or actual act around that. So agentic AI now completing the entire workflow in this entire scenario is basically creating much more value. It is giving time to our health practitioner to invest in a right proposition, not only doing all the other additional things. Health tech ecosystem involves many stakeholders. One is patient itself, second is the service provider or hospitals, and the practitioners, and the insurance provider. These are the 4 main service providers that are involved in that system. Everyone has its own specific roles, and agentic AI is binding all them together. So it's a revolution, I will say, and definitely not another wave. It's a change. World will slowly see that there's a change way of health tech or healthcare in coming days.
Okay, so it's interesting that AI in diagnosis gets a lot of attention, but the real momentum is building around the operational areas like scheduling and documentation. Why do you think that shift is happening?
Great question. And if I start with that, what is the biggest risk in health tech industry related to AI or agentic AI? That is the diagnosis actually. That whether this is a disease, what is the severity, etc., etc. That's a high risk game. But like keep it aside. The other important thing is administrative part, and that is, if as I mentioned earlier, that 1 hour of 1 hour of time spent on patient and 2 hours of time spent on other things, administrative thing and various other things. So now let me take you to the journey very, very quickly, that when we need to go for any healthcare attention, then how it starts generally, very, very rough way, that we see some symptom and then we book for an appointment with the right doctor, and then we wait there and we see that when doctor is available, and then we go for a encounter basically that we use in a medical term. Then there is a prescription, and then there is a follow-up, then there is a medicine, and then there is a further follow-up. And if you see that lot of things are, the real medical thing or real attention is between the encounter between the physician or the doctor and the patient, but rest everything is supporting system or documentation, administration. All this can be taken care of by agentic AI or AI in a way that starting from scheduling the appointment, seeing what is the right doctor nearby with me, my budget, my insurance, and so many other things, follow-ups, medicine and further follow-ups. All these things can be taken care of by agentic AI or AI in the current scenario. So that takes away a lot of pressure and gives a lot of flexibility in the entire healthcare system. That's why a revolution in healthcare system is not only on the diagnosis, it's on the administrative and documentation part as well. It's a great scope around that, and lot of clients that we are working with in To The New are in that area, because to be honest, it's a safe and fast access area that can be done via agentic AI and AI in the health tech industry.
To take this further, healthcare has always been reactive. We treat illness after we get the symptoms, right? But AI agents can potentially do early interventions. So how close are we to something that is more proactive and predictive?
So my very natural and first reaction is we are getting there. Let me explain it. That what is predictive versus reactive? Predictive, of course, that we can predict in advance and take the further action. And reactive is when something has happened and then we are doing that. Prediction in healthcare is already there. We all are wearing like this watch, and you're also wearing something, maybe wearing something. So there are devices that we are using, and those are continuously monitoring our health and symptoms around that. But the point is whether those inputs are being used in the right way or not. That is the point that we need to cover. Let me again put it in two parts. One is a post-operative things, or person who is dealing with some critical or chronic disease. That part is already happening in a predictive way. What does that mean? That now we have advanced to that stage that even person is at home and being monitored 24/7 by various devices and all the transplants and things like that. And those inputs are directly going via agentic AI into the system, and then from a server it's going to the doctor, and some actions what are designed and what has been prescribed are already happening. So that in those kind of scenario where post-operative or chronic diseases, it is happening, where we know something can happen. But for a very normal person kind of thing, it is still, there is a gap to cover. So what does that mean? That we have the inputs, but as of now, if I say that, okay, all this going in a very logical way and being acted upon, that is not happening. And that is the gap where from a system point of view, we need to cover as a society, like these many inputs, these many things, can we cover that? Are we equipped with that? Are the devices affordable enough for the common man? So these kind of things that need to be worked upon. But that's how I would conclude on that point, that for certain aspect we are there, for certain aspect we need to go.
So this shift is not only for the providers, right? How does this change the role of the patients, especially when they're generating all the data today? Do these patients become the CEO of their own health?
Great question, and I would say it's a aspirational goal, but it's feasible actually, right? Now let me expand on my thought process that what does a CEO means, or how do you define CEO in this scenario? So CEO should have all the data or the relevant information, I should say, the authority to take the decisions, and the resources to go get those decisions executed. That's how the CEO role you can envision, right? Now coming back to this health tech and our own health and being CEO on that one. Via Agentic AI, all this data information is with us. An individual can have, very much can have, like we can have all variables and things like that, and we can easily access our data. And our system, via use of AI and Agentic AI, that access of data is there. So that information I have. Now, the missing part or the improvement in that part should be that every person should be educated enough to understand those things to their level before they can call out for the action and things like that. So that is data. The resources or the authority to take the action, second part is authority to take the action. And this is where the Agentic AI comes into the picture, that it can, as we keep discussing, that it can link to various things and suggest what could be the actions around that. So that as a informed user or as an informed individual, I can always take help in what action I should be taking. Now we are coming to the resources part. So it is where all our healthcare providers, our hospitals are there as a resources for us, and we can always reach out to them for the action. Now, the important point here is all should work in a synchronization, and there are a lot of gaps to be honest in that one, right? As we are providing the right data, the data transformability between different hospitals, different systems. Are we using the same kind of devices? Whether we are really using that data and we can trust that data and healthcare system also can trust that data. So all these, there are missing links around that, where industry is working towards that. But being a CEO is a very, I will say, is aspiration and a right concept. And as an industry, we are moving towards that by the same logic, the information, the resources, and the action that we will be taking around that. So hopefully soon we'll be there.
And this brings me to something a lot of people are actually wondering about. Can AI in healthcare actually be trusted?
It's a very sensitive question, and I understand that it's the most asked question around that, and important as well. So I would start with that trust is not one-time thing, it's a continuous thing. Trust cannot be purchased, it has to be earned. So with that simple definition, it also very much applicable all here in the health tech as well, with AI and Agentic AI. So if I explain trust in this scenario, so there would be, it is driven by consistent results, transparency, and accountability. Consistent results are things which is continuously being worked upon, and how it can be maintained, that there is millions of records and data is flowing around with AI, Agentic AI, and that we keep feeding that data from a technology point of view, so that our agents, our models are as accurate as possible. Biases in the model has to be checked again and again, so that it is not giving the wrong result. So accuracy is extremely important, and we as an industry, we need to keep showing that, right? Transparency is equally important. All the healthcare agencies, hospitals, practitioners, they should be sharing upfront that what kind of models and things they are using in the patient's treatment. So transparency will make patient also aware that what is being used, how they are being treated, and there is a chance of some error as well. Nothing is 100% correct, including AI or Agentic AI. Even the normal diagnosis sometimes may go wrong, but the transparency means that I as an individual should know that I am being used via this mechanism via this particular model or things. This is the success rate. This is how it has happened. So that I feel comfortable that okay, what is being used for my treatment. So that transparency is very, very important. And it should not be by force. It should be by design. That what if we are using something agentic AI in the treatment, we should explain that person that how it should be there. And the last part is the accountability is also very important. Let me take an example in that. When it's all work in progress, nothing has been fixed as of now. Industry is working towards that. But accountability, for example, and how complex it is, let me give an example. That if, for example, something goes wrong somewhere, and it is some treatment was suggested by agentic AI or AI in that way, right? So who should be found, who should be accountable, right? The doctor who accepted that recommendation, or the hospital or that clinic who used that model, because ultimately doctor is using that one, or the organization, engineer, or some other company who created that model, right? Very complex. It's not easy, but that's how the things has to be worked upon. But with these combinations, I'm sure that we are able to achieve that. We will be able to achieve that in near future, and all are working towards that. Not easy, but we'll get there.
And finally, if we look ahead, how does a healthcare system powered by AI agents actually look like in the future?
It's very exciting to start with, and all the foundations are being built right now. So if I just explain it further, there are three major actors or three major stakeholders in the entire system, even today. So one is patient itself, and then second is healthcare service provider. It may be doctors, it may be insurance, whatever. And third one is AI itself, right? AI, agentic AI, the way we are using the AI. So these three actors are present even now, but the future looks like that this AI or agentic AI is not only a tool, it's a framework where everyone would be sitting and managing the things. Patient would be hopefully the CEO of its own. That's what we are aiming for, and that means that it has all the arms, animation, information to deal with that. Let me take some simple examples. Today, for example, if there is some problem with the health, and the first thing that we go to a doctor, for example, and then we identify what are the things with me or what could be wrong. That is how the journey starts as of now, mostly, right? But in future, that would be the point on a need basis. Means if I'm going for an encounter with doctor, that means that I would need some additional help which is not being treated or which is not being taken care of in general. In general means I am already being monitored by various devices, my data is being fed to the system. Doctor is already looking into that one and giving advices, whatever is needed in that one. I am already doing that. But some intervention is needed, further intervention is needed. Then only I am going to the hospital or meeting doctor. Maybe, for example, if in my opinion, that 80-90% cases would be only for surgical needs, or where you need a physical contact with the doctor, right? So that's how the current scenario will change in future in that way. Other one could be the chronic disease or the very critical disease. As of now, how it happened that okay, we have a review milestones, a few months, few weeks, or whatever way it is, and that's how doctor actually review that okay, position 1, position B on various time A and B. What is the difference? What needs to be done? Mostly it happens that way. This would be continuous. So that means that what is happening in critical diseases, that data is already being fed and all systems are connected. Agentic AI is working as agentic AI in the future, and everyone will know that what's happening, and that treatment is going continuous. Such a drastic change, right? In a periodic way, it's a continuous way for these critical diseases, and hopefully people will be very, very benefited with that. Many other things related to finding the right medicines quickly, finding the ways to treat better, because world will be connected and so much data will be to work upon. So that is where the interaction of these three entities will be improved. We spoke around operational efficiency. That would have a massive improvement, I would say. The support system that we have around healthcare, or the actual doctors or the practitioners, is too much as of now. That capacity can be reduced, that investment can be done elsewhere, and we can do much more with all that budget and manpower that we are using currently in that way. So it looks like that we are going towards that direction, and our future looks a very much coordinated effort between these three entities, and we'll be in a much better world, hopefully, in a near future, I will say.
Thank you, Anurag, for sharing your insights and perspective with us today.
Thank you, Malika. It was a pleasure speaking on such an important topic today.
And thank you to our listeners for tuning into Visionary Voices. If you are exploring how AI, data, and cloud technologies can transform healthcare systems, we hope this conversation gave you a valuable insight and fresh perspective. Stay tuned for more conversation with leaders shaping the future of technology and engineering. Until next time.